Hi, I'm Dorian Poulton. Before we begin, I will define a few key terms. A neurotypical person is a person whose neurotype matches the vast majority of the population. They don't have autism, ADHD, dyslexia, dyspraxia, or something else along those lines. I will also refer to neurotypical people as NT people sometimes. It means the same thing. This video will also discuss neurodiversity, by which I mean the concept that humans have natural variations in neurotype and that this is normal. This idea doesn't consider autistics, ADHDers, dyspraxics, or others with mental differences to be in need of fixing, but instead a valid and different type of human. I'll be discussing applied behavior analysis as it's applied to autistic people, which I also refer to as ABA, with a focus on its origins, modern practices, and the other concerns that have been raised by advocates. Before I go any further, I'm going to quickly summarize ABA. ABA is a therapy that's used with autistic children and adults. There is a variety of forms this therapy can take, including child-led and play-based methods. The therapy focuses on teaching cognitive, social, and functional skills such as dressing independently, using the bathroom, and reducing problematic behaviors such as headbanging or other self-injurious behaviors. The therapy typically involves many hours a week. ABA works from a theory called behaviorism, which considers only behavior and considers the internal experiences of a person to be outside of science's understanding. So historically, ABA's research and practice has only considered behavior and ignored the causes of autism and the psychological states of their patients and families. ABA does traditionally only focus on teaching new behaviors and removing or reshaping behaviors considered non-functional or harmful without considering the emotional experiences of their patients. Many proponents of ABA cite the fact that typically its methods primarily rely on positive reinforcement, with punishment being a last resort after multiple methods of positive reinforcement have failed. Modern ABA typically doesn't use punishment. If punishment is used, it typically is things like reprimands or something called overcorrection, where the response to an unwanted behavior is significantly larger than problematic behavior. In overcorrection, for example, the patient had knocked over their chair. Many of his patients were displaying behavior that we would now recognize as signs of extreme distress, such as self-harm. Some ABA practitioners still utilize the methods, such as the Judge Rosenberg Center, which up to 2018 was utilizing electric shocks as a way to treat and prevent self-injury and destructive behavior in developmentally disabled students. This is not widely accepted. The UN considered it torture. ABA has been shown to improve patient performance on IQ tests, their language skills, their ability to socialize, their adaptive behaviors, and to an extent, autistic ability to complete activities of daily living, such as self-feeding, dressing, hygiene-related tasks. These improvements are good things. They help improve independence and quality of life. And many proponents consider meta-analyses like the one cited here, which show that ABA improved outcomes in all of these areas, to be evidence that ABA is extremely beneficial to autistics and should be continued to practice with autistic patients. Many adult autistics consider the treatment of ABA to be abusive or harmful. To many autistics who were given ABA as children, the therapy was extremely traumatic. One of the main reasons for this is that ABA is based on behaviorism, so cannot consider the patient's internal experiences or emotional state. So patients showing obvious distress, exhaustion, sensory dysregulation, hunger, or physical pain may not be met with support, but instead further therapy focused on eliminating these problematic behaviors which arise from that distress. ABA also often doesn't consider their patients' behaviors from the point of view of an autistic person. So behaviors such as stimming, which are repetitive behaviors autistics often have, such as rocking or flapping, are targeted for elimination when they are in fact a key part of how autistics self-regulate and move through the world comfortably. There's also the fact that it is not uncommon for ABA therapists to use hand over hand, in which a therapist holds a patient's appendage and manipulates it so they complete a required task. Many autistics find touch uncomfortable by itself, and if a patient is refusing to do a task due to it being painful or uncomfortable for them to do, their boundaries and their attempt to protect themselves are further violated. ABA and positive behavior support, or PBS, are based around understandings of neurotypical development and focus on helping autistics progress through the neurotypical developmental process, which is the developmental process the majority of the population experiences. Autistics are not neurotypicals, and creating interventions to make development better match that of their neurotypical peers ignores the concept of neurodiversity, as ABA and positive behavioral support are about shaping autistic person's behavior so they can be more functional and better cope in their environment, rather than asking how their environment, by which I mean the people, places, and things these autistic people are asked to interact with, can be changed to better meet the autistic needs. This expectation that the autistic person change to benefit society built in neurotypicals rather than the other way around is not compatible with neuroscience-affirming practice. The therapy is meant to improve quality of life, but ABA is often done in patients who don't have capacity to make treatment decisions, leaving it to their families, carers, and treatment teams, who are likely all neurotypical, to pick goals which may not reflect what the patient wants. To review, the major arguments against ABA are that it is not neurodiversity affirming due to it basing its goals and curriculum around neurotypical development, asking the patient to better fit their environment rather than the other way around, and not having adequate input from the patient about what behaviors are targeted. Many autistic advocates also consider ABA to be traumatic due to it not respecting bodily autonomy and failing to consider patient distress. The arguments for ABA is that the therapy has changed significantly since it first began being practiced, with punishment typically only being used as a last resort after multiple positive reinforcement methods have failed. Punishments are also not like what was practiced in ABA's early days, with the punishment typically being a reprimand or overcorrection. When extreme physical punishments were used by the Judge Rotenberg Center, they were condemned as torture. Proponents of ABA also argue that the therapy improves patient IQs, language abilities, adaptive behavior, and skills of daily living, which should improve their quality of life. Please consider these questions. Is ABA in its current form helping autistic people or further contributing to their oppression? If it is hurting them, what changes do you think should be made to fix them? Should the history of ABA be strongly considered when considering how modern ABA is practiced, given that the field claims to have changed its methods dramatically since it was founded? Should autistic people be asked to alter their behavior to better function in society? To what extent should society change to better meet autistic people's needs?